What are the signs of menopause? What's the difference between that and perimenopause? Here to answer these questions and so much more is obstetrician and gynecologist Dr. Armity Simon. It's good to see you this morning.
Good morning,
This is a hot topic for a lot of women. Hot topic. Menopause. The difference between that and perimenopause. What is the difference?
Oftentimes patients ask, and I tell them, perimenopause is the time around menopause. It's not, you haven't quite gotten to the period of time that the periods will stop and the estrogen that is being produced by the ovaries will shut down. So some people will be in it 6 months, some people 10 years. So it's around the time of menopause that the fluctuation of hormones from that are produced by the ovaries is happening.
What are some of the symptoms then?
Some of the symptoms of perimenopause that are some of the symptoms of menopause as well are hot flashes, fatigue, your brain, weight gain, your brain's not working as well as it normally would, decreased libido or sex drive, a little bit of dryness, in different parts of the body. So there are different signs and symptoms, but I think the number one sign that people actually are worried about or they experience is the hot flashes, just not feeling comfortable. They just don't know what's going on.
And that's perimenopause, and that can happen as early as 10 years before actual menopause.
Menopause, or even earlier. Average age of menopause in this country is 51. So some people go through menopause or perimenopausal changes at age in the early 40s, others not until late 50s, so it averages out to 51. So if you are having some symptoms, bring it up to your doctor. It makes a difference, so we can check some hormones or guide you. And there are things that we can do to get people through those perimenopausal times by putting you on low doses of hormones or birth control pills or even diet and exercise and different type of foods and such.
Do you find more and more people or women are wanting to try the hormone replacement therapy? Is that becoming kind of the hot thing right now?
Well, it's interesting. I've been in practice for almost 20 years. So we actually had people, for years and years, people would go through menopause, they would get started right on the hormones, and they would stay on it. About 10 years ago, some studies came out that they said there's a slight increased risk of breast cancer and cardiovascular disease when people are on hormone replacement therapy. It was the World Health, the Women's Health Institute and
Well, I think we all remember when the news came out because everyone pretty much freaked out, thinking that's it, I'm getting off of all this.
Absolutely.
It scared them. But now it seems like the trend is that they're going back on because
because
they're not the synthetic, they're the bio.
Well, and I was going to tell you, if you were going to ask me, I was going to tell you about that. It's actually Women's Health Initiative. I'm sorry, I'm on TV, I'm a little nervous. So WHI, they came out and they said if women are on estrogen and progesterone for a while, that increases their risk of having potential breast cancer after they've been on it for 4 years, 1 in 1,000 above the normal risk. So the risk was minute.
So small. Okay.
But I have to tell you, in that period of time, I would say 75% of my patients that were on hormones went off.
Wow.
Ever since then, 60% of those people have gone back on the hormones. What do we do with hormone replacement therapy? There's all sorts of different kinds. Estrogen is what helps with the hot flashes, with the dryness, with the just the mental acuity and just overall feeling good. Progesterone is there to benefit, to make sure the lining of the uterus, if people have not had a hysterectomy, which I assume most people haven't, to protect the lining of the uterus. And then now we're replacing people with testosterone as well just for generalized well-being, libido, and just, muscle tone and feeling well.
Feeling good and energy.
Energy and just everything that, that they can do that. Combination of estrogen, testosterone really is what makes people feel well. And, some people don't need the testosterone. Some people need a minimal amount of estrogen. I always, in my practice, Lisa, tell people less is more. We can't throw everything at everybody, and there are different kinds of them.
Have you found people who are on the therapy before menopause, once they get to menopause, has an easier time with it?
Absolutely. And there are people who we have to start them on some sort of a treatment, whether it's bioidenticals, whether it's the good old-fashioned estrogen and progesterone, whether it's some sort of a topical formulation or a pellet formulation. get them through the perimenopause / a few years of menopause, and then we can eventually wean them off of things.
I see. Do they have to get checked often once they start replacement therapy as far as their levels?
I think some practices do, and depends on what kind of formulation you put people on. I think it's important to check people periodically because you don't want the levels to be so high that increases their risk of blood clot formation, that it puts them at jeopardy for other problems. For testosterone, you don't want people to start growing hair. You don't want people to start feeling really, so muscular that they kind of don't, they look like Pat, and you don't want, so there are different finesses. What I tell patients, and I'm really here for as a public service for you, to tell your patients, ask your doctors and make sure that, things are being done appropriately for the individual. At the end of the day,
Sure.
it has to be formulated for you, and it may be the exact same thing as I take, but, it's a trial and error.
And that you don't have to suffer through perimenopause where you have all those things and you think it's just part of what I have to go through. You don't really have to go through these awful stages.
Yes, absolutely.
There's something you can do. And I think for so many years you just thought, well, it's just part of getting older, right? You hear that? I just thought it was part of getting older.
Part of getting older. And you know what? A lot of people will say that, I started hormones and I gained weight. One of the things I wanted to make sure everybody kind of knows is when you become menopausal or perimenopausal, you will retain a little bit more weight here. And why? Because estrogen gets made in the peripheral fat. And when that happens, your estrogen level actually is stabilized. So as we all get older, you remember, my grandmother was a little heavier, my mother is a little heavier. It's because the peripheral fat makes some estrogen. So now we're trying to replace, because we all want to be, looking like you.
Or like, thank you so much.
It's my pleasure.
Good to see you.
It's my pleasure.
Really good information. I know lots and lots of folks are kind of confused about what's going on out there, so you clarified it for everybody. And if you want more information on Dr. Simon, it's super easy to reach her. You can go to drarmitysimon.com or give her a call at the number you see right there on your screen.